Pathology is the tissue basis of a disease or a disorder. So diseases may be classified into inflammatory diseases, which might be caused by either infections or other inflammatory processes within the body, or neoplastic diseases, which are tumors. Tumors may be benign or malignant tumors. And then, of course, there are genetic conditions and injuries or trauma to the body, which can also result in pathology to tissues. So histopathology is the study of an organ or a tissue, both at a macroscopic level, but also a microscopic level or histological level, where you would look at the tissue to see what changes are taking place in it, secondary to either inflammation or secondary to perhaps a neoplastic process, and whether that neoplastic process is benign or malignant, i.e. a cancer. Histopathology provides you with a tissue base on which further tests or analysis could be performed to tell you a bit more about the behavior of that tumor, the likely behavior of that tumor, whether it is an indolent, slow-growing tumor, or whether it is a biologically aggressive tumor that is likely to spread to different parts of the body and therefore requires clinical management much more urgently. The way in which a diagnosis can be made is either by taking a part of the organ out through surgery, or simply taking a core of tissue through it using a biopsy needle, or for appropriate lumps, perhaps superficial palpable lumps in the neck or the breast or the thyroid gland, using a very thin needle or a very fine needle through a procedure called fine needle aspiration, or FNA. This would allow a pathologist or a cytopathologist, accompanied by a biomedical scientist or a cytotechnologist, to see the patient, to collect the sample, to prepare good quality smears on the spot, to be able to assess the adequacy of the sample, and perhaps even to make a provisional diagnosis on the spot, which could be conveyed to the treating physician urgently. At the same time, it would allow the opportunity to collect additional material which may be used for tests in the laboratory, for again refining the diagnosis further, or for providing more information about the biological behavior of a particular tumor.